For the fire department, just as any public safety agency, your goal is to always make sure that you are improving the service that you give the customer. And that the customer isn't always just the tax-paying citizen. It's anybody that is within our city limits, anybody within our response area, that when they call help, they're our responsibility. We don't want our agencies here to just be average. We want to make sure that the customer is getting the best they can get. And the crisis response unit is that. We are improving a service.
Oftentimes what we see is a family member will call and saying that their son, their daughter, their husband, their wife is in a mental crisis. So their only default is to call the police because that's all they know who can come out and help them. CRU, what a valuable tool, because now we'll send CRU out to help those family members who otherwise don't know what to do. Since the CRU started, we've already seen the benefits from the police department side. It has reduced our calls for service because CRU is now responding to people with mental health issues or a mental crisis. They're there to help get the resources that these folks need, and it gives us the opportunity as a police department to respond to priority calls for service. CRU has been a very valuable asset in the very short time that they've gone live.
We believe that crisis response should send the best professional for the situation at hand. The focus is how can we help our neighbors get better, do better, so that the whole city is successful. So we've decided to have a combination of paramedics, behavioral health clinicians, and case managers. And the dispatchers and the call takers decide which city resource they're going to send.
Not everything elevates to a police response or the big red fire truck going out. These are just other resources that are helping people along the way. Many times in the past, your hands are kind of tied. These are the people that are going to come in and get those people that have the intermediate care needs, and they're not forgotten.
Once we're dispatched out, our job is to help people figure out how to resolve the crisis with the least amount of emergency resources needed.
This is taking us to that next level. We are trying to match the true need of the customer. We have that now, we have that tool, and it's not just that I came and met that customer today, fixed them for the day and left, right? We're there now to follow up with them. And our goal is to really be able to see them for 90 days to ensure that they're on the right path. But at that 90-day mark, if they're not where they need to be, we will continue to follow up with them. It's not a 90 days, you're with us and now you're out of the system.
Just to have the depth of services here in Round Rock is super exciting because we go in and we say, what can we do to make things better, easier, safer for everyone? And we have all those tools, and that is really cool.